Perfect. So who is a patient? And this is the question that we always get asked. So a patient is someone with lived experience of a specific condition, treatment, service, or an event. They can be current or former patients. They can be caregivers. So caregivers bring a unique perspective, caring for the patients, family members, or patient support groups. They're also considered patient in the realm of patient engagement in health research. Patient is also considered as patient organizations because they provide a representative voice and advocate for issues relevant to patient populations and conditions of interest, community groups, and members of public at large. So when it comes to patient, everyone is patient, but we want to capture this unique perspective from different angles. Moving on from patient to patient-oriented research. So patient-oriented research includes at least one of the following three things. And the first one is meaningfully engaging patients as partners. And I have highlighted that because our presentation basically is will emphasize on engaging patients as partners. The other two aspects of patient-oriented research are the project should focus on patient-identified priorities. So if you do some deliberation with patients or community members to engage to identify these priorities and do research on that, that's also considered a patient-oriented research. And finally, the patient-oriented research has the potential to improve patient outcomes. It includes some of the outcome measures like patient-reported outcome measures, patient-reported experience measures as the outcome. So our presentation will focus mostly on meaningfully engaging patients as partners. So what do you mean by meaningfully engaging patients as partner? It's just remember one thing, that it's not tokenism. Just don't do it as part of tokenism. And Brian will touch on this again. What do we mean by meaningful and active collaboration? So patients should be engaged in governance, priority setting, conducting research, and knowledge translation. And depending on the context, patient-oriented research may also engage people who bring the collective voice of specific or affected communities, which I already alluded in my previous slide. If you want to know more about patient-oriented research and patient engagement, you can check the CIHR patient engagement framework. So what are the four main pillars of patient engagement? So they are respect. So respecting patients as partners when they join your team, not considering them as equals or disrespecting their experiences. So respecting patients is a very important pillar of patient engagement. Co-building. So when you're building your research project, considering them as equal partners and co-building your project with them. Support is another important pillar of patient engagement. So supporting patients as well as seeking support from them for your research project. And finally, inclusiveness. So trying to bring different perspective, different voices as part of your project through patient engagement is the fourth important pillar of patient engagement. Now, there are different frameworks for patient engagement in research, because it's a lot of times it's very hard for researchers to, and this is, I'm speaking from my experience supporting different research teams, it's hard for people to understand or do these patient engagement activities. So there are some popular frameworks that can guide your patient engagement activities. On the left, you can see this IAP2, that's International Association of Participatory Research, or patient participation, public participation, sorry. IAP2 spectrum of public participation. So it's more linear, where you start with inform, consult, involve, collaborate, and empower. So you move from left spectrum to the right. The patient engagement activities that currently most of the research teams do are just basically inform. You do your research and you just inform patient population that these are the results. That's the lowest form of patient engagement, I would say. Consult is taking some advice from them, consulting them on some or more than one aspect of your patient of your project. So examples are focus groups or surveys or public meetings. Involve stage includes having workshops or deliberative polling. That's more back and forth communication. Collaborate is you are not just, as a researcher, you are not just communicating with the research partners, patient partners, but also they are collaborating with each other to provide feedback on your comment. And empower is basically the way where all of us, all of the patient partners and researchers are sitting on the same table, and you are basically empowering patient partners to be equal partners on your project. On the right is another framework that, and we recommend the right side one, which is more circular. Just like a research cycle, the patient engagement doesn't have to be linear. We feel that it should be circular. And I have provided the reference to the study from which this framework is put here. So that involves all these steps according to the research cycle, and it is a circular one. So you can go back to the initial stage to improve your research project, and different patient engagement activities that you can incorporate in your project. And I'll hand over to Brian to talk about what is meaningful engagement in patient research. Brian?
Thank you, Samit. So yeah, I'm going to do a lot of emphasis on the partnership aspect of it, having had experience as a partner in a number of research projects. When we talk about partnership, we're talking about that melding together of the scientific information and knowledge about a disease with the practical, the lived experience that a person brings to it. Reading about it in a book is very, very different from living through it year after year, day after day, day after day. And so as it shows in the slide there, effective partnership, shared values, acknowledging the expertise that both sides bring to the project, and mutual accountability. And Samit, you talked about meaningful, active collaboration. I think the next slide is a bit of a repeat of that. So again, we're talking about that meaningful collaboration. We're not talking about engaging. We're not talking about participation. We're talking about an actively engaged partnership. So involved right from the beginning. And this is just another sort of mini cycle, starting right from the evaluating the beginning of the project, creating the culture around the project team itself, employing the right technology, empowering all of the patients that are involved, and just being ready to evolve and change as required, and respecting the input that each party brings to the project. And the last bullet over on the side there talks about knowledge translation. And quite often that's where the patients can really help out, is putting the research, or putting the findings, putting the information in plain language, and putting it and delivering it in a format or a way that can be understood and accepted by the general population or specific populations that you may be targeting. Next slide, Samit. Again, this one is very similar to the very early slide that Samit showed with the circular process of a research project. And again, it's just engaging right from the very beginning, from the design. Patient partners can be involved in the application process. Patient partners can be brought in as a co-applicant right from the beginning. I've been involved in that. Can be a collaborator, can be used in knowledge translation towards the end of it. But again, it's just that full engagement and accepting of the expertise, the lived experience that patient partner brings. And next slide, Samit. This is a model from John Dewey, and just shows that patient-oriented research, patient engagement is the cornerstone of research. And the emphasis again is on the experience of living with an illness is essential for understanding that illness. I did a project recently with a couple of folks who were heart transplant recipients. And you look at what they went through. Some of them born with a defective heart, some of them diagnosed early on, going through test after test after test, finally to be told that the only solution is a transplant, to spend months or longer waiting and hoping and praying for that transplant to come true, and at the same time experiencing that guilt that comes, that knows that you know what you're praying for is that someone else is going to have to die for you to be able to live. And then to spend that time in the hospital when it finally comes time, to the surgery, to the rehab that's involved in it, going back out into your home environment, all the changes that take place in your lifestyle, the physio that follows through on it, and just lifelong monitoring, and all the time hanging over your head that knowledge that This may not be a forever heart. That may not last that long. So the lived experience is very, very different than having read about or studied or having knowledge of conducting that cardiology, that heart transplant. And next one, Samid. And there's no one cookie cutter approach. Samid showed you a couple of, the process that we like to follow, the circular process that we like to follow, but you may want to adapt depending on the group that you're working with, depending on the patient partners that you have, and you want to listen and adapt as required to come up with the most effective project. You want to be inclusive. You want to make sure that they're involved in all levels. As we said earlier, building capacity, using the maximum capacity of both parties together to get that synergy and get that maximum effect in results. Honest communication, valuing the experience and knowledge that each person brings to the project, or each party brings to the project, and shared sense of purpose. Again, it all comes back to that one word: partnership, collaboration, working together, and truly understanding and accepting what each party brings to the process. Samid?
Absolutely. Thanks, Brian. So with this understanding of patient engagement and patient-oriented research, I wanted to introduce SPOR support units. So SPOR support units, SPOR stands for Strategy for Patient-Oriented Research, and I touched on what is considered a patient-oriented research and patient engagement being one of the most important aspect of patient-oriented research. So the federal and provincial partnership was formed to create this SPOR unit. The first phase was 5 years, for 5 years from 2015 to 2020. Now we are starting the SPOR 2.0. So our unit, my platform, patient engagement platform, is part of Alberta SPOR support unit. Our mandate is to encourage and support patient-oriented research in Alberta. So at Alberta SPOR support unit, we have 4 platforms: patient engagement platform, data and methods platform, capacity development platform, and knowledge translation platform. This is in 2.0 version. Patient engagement platform is led by Dr. Maria Santana here at the University of Calgary, and I'm part of patient engagement platform. Brian also is part of one of the initiatives led by our platform. We partner with different organizations in Alberta. So Alberta Health Services, Alberta Innovates, Athabasca University, other academic institutions in Alberta, also some community organizations that our platform engages. And I'll have a slide about community engagement as well. If you want to receive the services from Alberta SPOR support unit, basically the research setting and or investigator should be in Alberta. The project should be patient-oriented. There should be some end-user engagement, and there should be a potential of patient and system impact at the Alberta level. If you want to check more about the eligibility to receive support for your project, or if you're wondering whether my project meets the criteria, or how do I do patient engagement, then you can check appsforyou.ca for more information. Now coming to the question of how can I engage patients in my project? And that's the common question that we get, and that's part of my job, where I meet with different research teams and kind of discuss the ways they can engage patients in their projects. So if you look at a traditional cycle of a traditional research cycle, you usually start with planning and preparation, is designing study, then implementation or data collection, data analysis, and then dissemination. And this is the general version of a research cycle. And in the bottom, there is a note, and keep this in mind throughout by next few slides, that patient partners are not research subjects. So they are not participants of your project. So you are not collecting data from them as a participants, but they are partners. They are part of your research team. So how can patient partners help you in these different stages? So first one, for example, planning and preparation. Patient partners can help you with conceptualizing your project. So if you have an idea, for example, having a patient partner running the idea with them, just going through, does it make sense? Do you think that I need to explore this? Is it important for patient's perspective? Right from there to reviewing your proposal. If you have a brief proposal or draft, sending them over and just to see that if they have any feedback for you. Patient partners can help identify more patient partners. If you just started with one patient partner, you want more. Usually patients are connected with each other through the common condition they are facing, or through the organizations they are part of. So they can help you to identify more patient partners. They can help you with writing lay abstracts. And this is one of the hardest things I personally as a researcher face, is writing lay abstracts. So patient partners can do excellent job in kind of reviewing your abstract and seeing that does it still have a lot of acronyms? Does it still are there any words that don't make sense from common patient person's perspective? So they can also be part of your grant application. Increasingly, more and more number of teams are including patient partners as part of the teams in the grants when they submit to CIHR or any other funding agencies. Patient partners can also provide letters of support, which shows, and they can outline that what kind of activities they will be engaged in, which shows strong focus on patient engagement for that project, and not just a tokenistic approach where you just list them, but providing letters of support, which lists the things that patients will be providing throughout the project, will strengthen your application for grants. Study design, if a research team is thinking about designing a study, and this applies to graduate students or trainees as well. Me being a trainee, I wear these two hats, so I incorporated patient engagement as part of my project, and I'll be giving the example from my project. But they can help you to review research tools. Patient partners can ensure the methods are feasible and sensitive to the situation of potential research participants. They can also provide feedback on ways to recruit the participants for your study. Or they can also help you to ensure that interventions are acceptable by research participants if the study involves any intervention. Also, they can help you to identify outcomes of interest from patients' perspective. A lot of time, research teams just choose the outcomes based on the literature or based on their own understanding that what might be important for patients. So having a patient partner on the table would help you to identify outcomes of interest from patients' perspective. For study implementation, patient partners can create participant recruitment material. A lot of teams use patient partners because they are more connected with the community, so they understand what attracts them, what type of material would be helpful to recruit more patients. So they can provide feedback on them. They can help increase the recruitment into the study. They can actually do recruitment. They have some. I've come across some studies where patient partners went in the clinics, for example, and they did the recruitment for the research teams. Them being a patient in a similar condition, other patients connect very well with them, and that helps in increase recruitment into this study. They can help with data collection. So administering surveys, for example, is some of the things that they can do. Or if it's a qualitative study, then maybe conducting their interviews or doing focus groups for qualitative projects is some of the things that patient partners can do for your project. When it comes to data analysis, a lot of time the data is analyzed just by few people, analysts or the PI or few core members. But having a patient partner helps you to take a diverse perspective into the account when analyzing the data and when making decisions. Also, it provides explanation on some of the trends in your data from patients' perspective. It also helps you with coding or thematic analysis if it's a qualitative study. Also, patients can provide comments on data visualization. So if you want to present the data, what would be a better way to present it to lay public rather than showing our usual graphs and tables? If there is any other way to better visualize the data, patient partners are excellent resources for that. Lastly, dissemination. In this stage, patient partners can influence the language and content of information to be more appropriate and accessible before disseminating your results. Patient partners can advocate for uptake of evidence in local health systems through their channel, to their networks. Patient partners can reach out to various patient advocacy groups to increase uptake of evidence in policy. We have seen this a lot of time, some disease-specific patient advocacy groups. They are very very eager to work with researchers and bring that evidence and advocate for incorporation of that evidence into policy. So they can make that connection for you. Patient partners can co-present at academic conferences. And we have seen this, we are seeing this, this change where a lot of times researchers, when they're presenting at academic conferences, at least pre-COVID, the patient partners would come on the stage and explain what is the condition, how it has impacted their life, and why this research is important, and the significance of that research from a patient's perspective. That has more impact on the audience and for people to understand the importance of this project from patients' perspective. So co-presenting at academic conferences, co-authorship, and we have an article if anyone is interested to know about co-authorship, that how patient partners are increasingly being listed as co-authors. They provide excellent feedback on the manuscript, and they are increasingly being listed as co-authors in peer-reviewed publications. And journals are actually encouraging research teams to include patient partners as co-authors if they have worked with them. What about REB approval? This is another question. So ending with the research cycle, a lot of people ask, do I need to get REB approval for patient engagement activities? So different provinces and territories have different requirements, but they are not usually the barrier. If you communicate with them, if you explain what exactly is patient engagement, from our experience, we feel that REBs, research ethics boards, are still catching up with this concept of patient partners, not participants. But if you explain to them what is a patient partner, then we have got number of projects where REBs have approved the patient partner piece of it without the thorough process. Research should fully describe how patients will contribute to the research and what access to information they may have. Patients who are research partners should be listed as members of the research team. And this is the important thing, that when you list the members of your team, include them as the research team members, not the participants. So, and again, I'm reiterating the same thing: patient partners are not research subjects; they are not study participants. Another consideration to have when you do patient engagement is how to have a budget around patient engagement activities. And you need to consider two things. First is reimbursement. So if you are researchers are salaried, trainees get the stipend or whatever, they are doing this as part of their professional life. Patient partners would be doing it because they are passionate about it. They want to change things. So we don't need to, as researchers, we don't need to put additional burden on them. So reimbursement to cover direct costs and expenses associated with participating in research. So if you are doing an in-person meeting, then make sure you cover the parking. If you are taking them for a conference with you to co-present, make sure to cover their travel expenses, childcare, or any other type of support they might need. And compensation is basically a payment for the time, skills, and lived experience and expertise that these patient partners bring to research project or related activities. Compensation can include direct payments, in-kind contributions like conference travels, cash, or honoraria. Also make sure to have this discussion with your patient partners and also give them option to opt out. We have had teams where some patient partners say, no, I'm doing this as a service. As a volunteer, I don't want any support or any compensation like a gift card or anything. And some of them are like, yeah, it's appreciated. I have some other needs at home, and I'm spending my time here. So appreciate the compensation is appreciated. But that's a discussion that you should have with your patient partners. Also, our platform, patient engagement platform, uses $25 per hour as a benchmark for any type of activities you are doing with patient partners as part of the project. Next question that we frequently get asked is, how many patients do I need to engage? Well, there is no ideal number for patients to engage in research, especially from patient engagement perspective. You are not doing a huge quantitative study where you do need power calculations or the team. Our best answer is, don't rely on one patient partner, because that's too few. Like, that person cannot be representative of the population that you are trying to reach out to. And if there is an issue with that patient partner, if throughout the project in the middle something comes up, they are not interested in the project, or if there are any conflicts, then you don't want to have a situation where you don't have a patient partner. So try to be picky. You can be picky about patient partners. Choose the people based on just like the way you would choose a partner for your research team. If you are working with someone, with a member of your team, you choose them for certain reasons. So be a little bit picky. But keep this one thing in mind, that they should come from broad range of backgrounds. But it should be manageable. So having 4 or 5 people, for example, 4 or 5 patient partners is good. Depending on the project you have, you can be picky about what kind of skills they need, because sometimes being engaged in research, sometimes you might want them to do a little bit of data collection, for example, qualitative things. Then a person who understands what, or have basic understanding of what is a focus group, or if you explain to them, and they would be able to understand what it is, that kind of things, or requiring basic computer skills. These kind of things can be your criteria to choose patient partners. And again, remember, tokenism is not patient engagement. So don't just include people just to show on the grant and then don't engage with them. Now for the examples. So this is the one of the example of patient engagement activity, and this is my project. So on the right, if you can see, this is the group of patient engagement or patient partners for a Kids PRO project. So my PhD project is investigating the integration of prompts in pediatric clinical care for asthma here in Calgary. So at the beginning of the project, what we did was we did not start with recruitment of patient participants. We started with patient partners, even before we started many of the activities. And so patient partners, basically, this is a group of 5 kids and their mothers. So our youngest patient partner is in the orange shorts. Nicholas, he's just 8 years old. At the time of when we took pictures, he was 8 years old, and the oldest one is Kim, and she was 18 at that time. And so these are the patient partners. So whenever we were doing something, we kind of went to them or had a monthly meeting, or had like meeting every 2-3 months, just to update them what it is, what are we doing, does it make sense? So they helped us with recruitment strategies for participant recruitment. They helped us co-design the Kids PRO platform. So Kids PRO platform is basically a web-based electronic platform to administer prompts and collect that data. So they helped us to co-design, like what kind of things would be easy for patients to complete, what kind of login protocol we should have for patient partners, for patients if they want to complete these questionnaires. They helped us to co-design Kids Pro user guide. So once we have this platform developed, if patients are going to use it, they will need guidance, or they would need a user guide. So we developed a first draft, and then we had a meeting and asked them for their feedback. In the user guide, we have some cases around how could prompts help with better delivery of care or better understanding of patients. Those cases came from them. So they told us, actually, I face this problem being an asthmatic patient, and I think prompts would help me in these ways. So based on their stories, or the stories or the situations they mentioned, we developed the case studies that are part of the user guide. Co-design Kids PRO logo. So on the right bottom, if you see the logo, that was co-designed along with consultation with our patient partners. So we worked with a logo designer who gave several designs, but the colors for it, which exactly logo they want, what kind of font they want, the size, all those kind of things were co-designed with our patient partners. As part of this study, this project, we did a systematic review, where even they provided feedback on systematic review. And it was an interesting experience for me as a researcher, because patient engagement in pediatrics is still fairly new. So explaining them what is a systematic review, comparing it with buying clothes on Google and how you search, just like that, searching databases. What does it mean when you get so many results? How do you screen? All those, explaining that process, and then presenting the results and asking them, does it make sense to you from patient's perspective? And interestingly, on one of the outcome, I got a different perspective from a patient partners, where the systematic review showed that, for example, using prompts might increase the referral rates for patients. Patient partners felt, no, actually it should reduce, because now you're not doing this shopping of tests. You're not being referred to someone without any reason. Now your healthcare provider understands you better, so they should not refer you. So the referral rate should decrease. And I incorporated that as part of the manuscript, and it was appreciated by the reviewers when I submitted it, and then the systematic review is published by reviewers, that patient partners' feedback was incorporated in the systematic review. So these are some of the examples. Patient recruitment, and there is an asterisk there because of COVID. We had to cancel the plan, otherwise 2 of our patient partners were going to help us with patient recruitment at Alberta Children's Hospital. Also co-presentation, they were going to co-present at a conference, but the conference was canceled due to COVID. But this is an example of how patient engagement can look like in the real life. Next example is from adult world. So this is a project here by Dr. Kristin Feist, where they co-design a patient and family or caregiver-oriented transition in care bundle. Again, different types of activities. Patient partner facilitated a tier 2 priority setting meeting. They co-created a poster. They wrote an article. They submitted a grant and provided letter of support. Patient partners attended and contributed to a stakeholders meeting. And that engagement is not just at one point, but at different time points. The next example is from an innovative pediatric clinical trial, where patient partners co-design patient-informed recruitment strategy. They developed a protocol for sites. They co-facilitated patient engagement workshops. They developed overarching patient engagement strategies. They produced 2 articles, supported training at sites with other coordinators. These last 2 examples are from my other colleague who have worked with this team. I wasn't directly involved in these projects, but these are some of the projects just to give you an example of patient engagement activities. Lastly, to let you know that if you are interested in patient engagement in your project, then you are not alone. You have plenty of support available here through our platform. So from our platform, from Patient Engagement Platform, we provide many type of support. So some of them are listed here. For example, we help you to access capacity development and team training resources around patient engagement. We'll help you to access patient partners through online patient network. So this is a common question that we get, that, I want to engage patient partners, but I don't know how to get those patient partners who can be the patient partners on my project. So we kind of provide feedback or suggest them some better ways to do it on their own. But we also have a province-wide network of patient partners called Albertans for Health Research. So this is a web-based network where patients in Alberta sign up to be patient partners. So if a research team is interested in having patient partners, we help them create a registry posting on this website, and the patient partners can see and sign up and can contact the researchers to be engaged in the project. We also use social media, Facebook, Twitter, and all other different ways to reach out to wider community. We also have community partnerships with different organizations. So if any researcher is looking for patient partners from a certain population, then we can reach out to that population through our community organizations. We also help research teams to assess patient engagement readiness. We help them determine a budget for patient engagement, develop patient engagement plan, evaluate patient engagement experience at the end of it, identify and mentor patient liaisons if you have any patient partners, link and match researchers to patients and patient groups, mentor or coach patients and researchers in engagement activities, how to have first meeting, what kind of things you should have, you should do in patient engagement to begin your patient engagement. We also have small monetary awards. So Accelerator Award is for graduate students. If you want to do patient engagement just to get you started, you want to have first meeting, so maybe small $200-300 support just to get you started with patient engagement activities. Patient Partner Conference Travel Award that was to support patient partners if they are traveling to co-present with a researcher at some conference. We also have list of resources. So how to guide for researchers, how to do patient engagement guide for patient partners, ethical guidelines for patient engagement, the terms of reference for patient engagement, patient partner appreciation guideline. I just now mentioned that we suggest, we recommend $25 per hour as a benchmark for providing compensation to patients. Then cost calculators for budget reconsideration, co-authorship for patient partners, evaluation of patient engagement. All these kind of resources are also available through our platform. If you want to request services from us, simply go to apps4u.ca. If you click on data plus service tab, you will see there are three subheadings on service descriptions, service application, and letter of support. So you can see the service descriptions to see all the types of services that are provided by Apps4U, including our platform. If you just need support from us, you can mention that in the service request form. If you need from other platforms as well, then we can jointly provide that consultation with you. Service application, you can request services from us, or if you are writing a grant application and you require a letter of support from us, then you can download the form there and just send it to apps4u at albertainnovates.ca, and it gets processed and we can provide a letter of support for your project as well. The service request form includes contact information, study information, funding information. If you are working with any SCNs or SPOR units, what is the study about, and then services from the patient engagement platform. So in the form on the right, where I have put the arrow, patient engagement platform is listed there. You can choose the type of activities or type of support you need from our platform, and we will try to provide that services to you. So the way it works is that your application is processed at backend from Apps4U, then different platforms are reached out depending on your request, and then we meet with you and provide the consultation. And then if you need services from us, then we can provide the services, or if you just need a letter of support, we can do that as well. And this is the Albertans for Health Research.ca that I mentioned, a province-wide kind of network of patients. On the left, you can see some of the opportunities that are posted there for different research projects. We list you or some member of your team. If potential research patient partners are interested in joining that research project, then they can directly contact you. So this is kind of a matchmaking site. Community engagement, we have one of my colleagues is a community engagement coordinator. So she constantly is in contact with different organizations, community organizations throughout Alberta, not just in Calgary, but for example, newcomer organization or organizations from certain populations, and she can help you to make connections to the population that you are trying to reach through those community organizations. Just a quick blurb on another program, and this might be important for if there are any faculty members who want to develop capacity around patient engagement as part of their team. So you can have, if you identify a patient partner, you plan to work with them for a longer time, then you can sponsor their training through PACER program. So PACER program here, it's offered through University of Calgary. So it's a patient and community engagement research program. So where patient partners are trained through given basic training, and Brian has done, I think, patient PACER program, so he can answer any questions if you have. But this is a training where they train what is patient partners on what is research, how to conduct qualitative interviews, what are focus groups, how to provide feedback on different projects. They also have a capstone project where they do actual research project. We also run journal club. Just before this meeting this morning, we had a journal club. So if you're interested in patient engagement, want to learn more about patient engagement, then you can join our monthly patient engagement journal club. Yeah, and that's it. So just to summarize what we talked about is patient engagement sometimes can be a bit intimidating for a lot of researchers. They don't know what value patients would bring, but we are there to support you. If you have any questions around patient engagement, we are more than happy to help. And if you have any questions, we'll take them now. If not, if you want to contact us later, I have included my email. So feel free to reach out to us or visit apps4u.ca. Thank you.
Thank you so much. That was great. We actually do have a couple of questions that have come in already on the chat there. So I'll just read one out here from Laurel asking, do you recommend a dedicated person to do this work on the research team? Usually the research coordinator does this on top of everything else. And can you talk about the amount of time it takes to develop these relationships to support best practices?
Okay, I will provide the answer from my perspective, and then Brian, you can jump in from the relationship perspective, that how long does it take to develop this relationship. So I don't think you need a specific a dedicated person to do this kind of work, because you are basically saying that your patient partners are part of your team, but to manage those team members, you need an extra person or a dedicated person. That's not true. They are part of your team. So you don't need to have a dedicated research coordinator, because patient partners can be 3, 4, 5. And again, I'm speaking from a perspective of a smaller research project, not like a huge project or pan-Canadian project. If it's a pan-Canadian project or international project, then you might need a person with some dedicated time for patient to coordinate with these patient partners who are located in different places, or it's a huge team to monitor. But for a smaller project, you can do it on your own. They are members of your team, just like you have other members like trainees or research coordinators or analysts. So you would need a dedicated time. And Brian, do you want to speak about the relationship aspect?
There's no magic time as to how long it takes. It depends on the environment that the patient partner comes into. I think that my very first experience, I was a little skeptical. You mentioned tokenism. Took a couple of meetings, probably 3 meetings or so, before all of a sudden I realized, hey, they are listening to what I have to contribute, and they are making some changes to it. So as I said, all depends on the environment. I think that from my perspective, as you do more, you have higher expectations, and just assume that it is going to be a true partnership. And I've had some remarkable experiences.
That's great. We have another question there regarding the PACER training. Is there a cost to the patients to complete that training?
Yeah, and so I don't run the, I'm not completely familiar with PACER program. That's why I just added one slide. But the reason I added it, because that's one of the resources that you can look into. So there are 2 ways. So patient partners can themselves enroll into PACER program, and they pay their fees or cost. But also a research team can do that. So some of the research teams reach out to us and they say, I have these 2 patient partners, and I will cover their expenses. I would cover their costs for the training, and they would work for me on that project. The benefit of it is that patients get training for free, and the research team gets this capacity in their own team. But there is a cost involved, and the program is offered through continuous education at the University of Calgary. And thank you, Laura, for putting the link, pacerinnovates.ca. So if you have any specific questions around PACERs, feel free to reach out to them, and they will be more than happy to answer your question.
And we're after getting another question here from Todd. Do you have experience with patient-oriented research and Pillar 1 projects? And if so, can you comment on how similar or different that is?
Yeah, I personally don't understand what do you mean by Pillar 1 projects. Can you elaborate, or someone else?
Basic research, fundamental project.
Oh, okay, sorry. Yeah, we have been working with some of the basic scientists as well. So if you know Mitochan, this is a pan-Canadian organization where they work. The scientists are basic bench scientists who are working on mitochondrial diseases. So they are engaging patients as well. We recently did a collaboration with them where we kind of give sessions on patient engagement activities. This morning we had a researcher. She's actually a frequent attendee for our journal club. She's a basic scientist at Memorial University in Finland, Newfoundland, and she sees the value of patients to understand the impact of whatever research they do bedside, how it will look bedside, or what kind of impact it will have on the society. So there are some projects. Of course, the level of engagement would be different. Patient partners would not be able to, collect the data for you, but maybe understanding some things, or putting together a lay abstract, or creating the dissemination material for you, or co-presenting the findings for your project. These kind of activities patient partners can do for even basic science project. I don't know if that answers your question, but yeah, okay, thanks for the thumbs up.
Someone else has a question here, Kristin, on any comments on when researchers also have a lived experience with the health condition they study. She's not suggesting that this replaces patient partners, but it might complicate things somehow. So I think it's about those lived experiences and the interplay of those.
Right, absolutely. And this is the thing, being a health researcher, or if you're a healthcare provider, you have certain biases or certain level of understanding that you have developed by working in the health system. So having a patient partner who was not a healthcare provider, would be considered, would be bringing that experience that wider population has. But again, it doesn't exclude healthcare providers. So if a healthcare provider has a lived experience, then they can also be engaged as patient partners. But it's, again, I told you, it has to be picky if you want, because most of our population does not work as healthcare providers. So for them, if you want to bring the perspective of general population, then it's better to get someone who is not a healthcare provider. Brian, do you have any comments on that?
No, I don't know if it would be a conflict, but I think anyone who has a chronic health conditions are going to understand that there's some variety between patients. My experience with cancer is very different from my late wife's experience with cancer. And like Sumit said, I think that there's value in having multiple perspectives coming from the lived experience.
Mm-hmm. There was just someone here, Murray, who said very enthusiastic presentation and that they'd like to talk to you, but they have to go to another Zoom. So your contact details are there anyway, if anyone wants to reach out to you after. And Anna said, thank you to you both for a great talk and sharing your experience. You mentioned involving patient partners in recruitment and data collection. Do you have any suggestions on how to mitigate potential issues of undue influence? So for example, participants feeling they have to say yes because they know each other or answer differently. So how to kind of mitigate potential issues?
Yeah, that's a great question. There are two issues. So sometimes we have this issue of, if a healthcare provider asks a patient participant or a participant to participate in their study, there is this power imbalance, because they are your healthcare provider, or because the patients might feel that, I might not get the level of care that I would get if I refuse to participate in this study. Having a patient partner doing that job for you actually reduces that power imbalance. And now, because you have the similar condition, someone reaches out to you and says that, I have been through this kind of condition, so now I'm part of this research study where the researchers are actually trying to answer the problem that you face, that I face. So would you like to participate in this study? It brings more connection. If they have any questions, they can ask the questions. They can ask the patient partners about those questions. Patient partners, if they don't have answers, they can say, I can get back to you. I'll talk with the PI or the person in charge of the study and let you know. But in my opinion, I think it reduces this influence or pressure on patient participants to participate in study if you have patient partners doing that kind of job. I'm not sure if that answers your question. And Brian, feel free to jump in.
Just going to say, I did some nominal recruitment on one of the projects, and people have no hesitation saying no. But I think that it gives you the opportunity for that honest dialogue between each other because you do know each other. And as Sumit said, they don't feel forced to do so. So I've had success having friends and people I know as acquaintances jumping on board. And I've also had experiences where they're saying, I don't feel comfortable sharing my my experiences with people I don't know, and no thanks.
Yeah. And it's easier for them to open up in front of another patient or
Absolutely.
who has lived with that experience than in front of a healthcare provider.
Mhm. Another question here, first off, saying that you've given a rich and informational presentation to you both. Have you used more heavily weighted voices from patient partners when trying to achieve consensus to overcome power imbalances?
Yeah, great question again. I'm not entirely sure what do you mean by heavily weighted voices from patient partners. Because when you have a team of patient partners, some of them would be a little bit, called, and I'm assuming that that's what you mean by heavily weighted, is that some of them might have a lot of more experience, some of them might be more, more talkative or be more forthcoming about their experiences. But then that's the skill for the research team to identify and make sure every patient partner has equal voice, or at least are given opportunity. And some of the patient partners, frankly, do not. And that's the beauty of patient engagement. They don't want to be open for everything. Some of the activities they are not interested in participating, and some of the activities they feel like they're passionate about it. For example, a patient partner, if you have a team of 5 patient partners for your project, some of them would have very good interpersonal skills. So they will say like, I would love to do this, some type of activities like patient recruitment or something. Some other people might be a little bit introvert or don't want to have that communication, but they say, I would help with writing, or I think that I can provide feedback on lay abstract. So there is no heavy weight, and it's at the researchers' end to make sure that everybody feels that they have equal kind of power, and there is no such power imbalance. And say a right of veto in Delphi process. So Delphi process is a very formal process of reaching consensus. Here in patient engagement, you don't go to that extreme of, of formal process to reach consensus. It's just as a team. There is a PI for the project. There are other team members. When you discuss on a certain type of study design, and you kind of decide what pros and cons, you discuss it. It's more engagement and collaborative working rather than doing like a formal process of like a Delphi process. Hope that answers your question, Michelle.
Yeah, so thank you very much. I actually have a question in regards to sustaining the patient partnership and the patient engagement. What strategies have you both come across, or that the evidence supports are kind of the best strategies to try and sustain this? Because, if we get a grant funded, for example, and we have patient partners, that project might be over 3 to 5 years. How do we go about trying to sustain that partnership?
Ryan, you want to go first?
Sorry, just unmuting myself there. The Dragonfly project that I'm working on is a 2.5-year project. All I can say is the partnership is sustained because you feel of value. You feel you're making a contribution. You feel that you're being listened to, and you feel that you're making a difference in the overall project. Compensation. Sumit talked about compensation. I hope that's not the reason that that someone continues to work. I think again, it's just the relationship, it's the collaboration, it's the partnership. And going back to the last question about undue influence, partners are not always equal. You can have a junior partner, a senior partner. It's simply a matter of being listened to, and if the decision or direction is contrary to what you had suggested, it's having it explained and understanding the reason for the decisions. So sorry, I don't have a quick answer. Here's the tool to use.
No, but it shows the importance of the relationships really to sustain that. Yeah.
Sure. Yeah, and great question, Rachel, again around sustainability. So it's the sustainability, you have to look at from two sides. From health researcher point of view, you for example, you got a grant for 2-3 years. You work on with that patient partner on that project. You are most likely going to work in that similar domain, or you are going to collaborate with someone. So throughout this first project that you work with this patient partner, you build this relationship. Those patient partners would help you with your future projects as well. They can also sometimes research teams suggest other researchers that, I work with this patient partner, he or she was valuable in providing feedback. If you are looking for this one, or you have a project why don't you also ask him or her to be patient partner? So from researchers' point of view, they are developing capacity in research community around them and for their project. And from patient partners' perspective, just like Brian mentioned, they feel that they provided value, they were listened to. So now they want to work with other research teams, not only on the project or their end, because a lot of times, for example, patients with chronic conditions, they might have multiple conditions. So sometimes earlier they were part of a project where it was project around cardiovascular health, or they had hypertension. They might have other condition, and other research team, if they are looking for patient partners, then the same patient partners, because they have this experience of providing feedback and working as patient partners, they would be willing to participate in other studies as well. And we have a number of patient partners who started with just one project, and now they are providing support, or are being patient partner with number of other projects.
I was just going to say, Samid, in terms of continued sustainability as well, some of the responsibility is on the research team themselves. This project I'm doing right now, heavily involved in the beginning, then there's sort of a component of it that I'm not heavily involved in, then you get pulled back in again. But the key is that every meeting, every step of the way, I've been invited, I've been participated in it, even if I did not have a direct involvement, but they have continued to remind me that I'm a valued part of that project.
Absolutely.
Yeah, so kind of keeping up that communication throughout
Absolutely.
the process. Yeah. Is there any other questions? Maybe while we're waiting for another to come in, I just think an important one for today's session in regards to child health is, could you maybe describe, because in your own project you have child patient partners, and could you maybe just talk about the differences between that and dealing with the adult populations when we're talking about patient engagement and partnership?
Absolutely. And so when I started patient engagement in pediatrics, and I was not in my current role as a assistant director, I was just a PhD candidate trying to do patient engagement as part of my project. There are very few studies that talk about patient engagement. A lot of them talk about patient, working with kids for your research in your research project, but those kids are participants, not partners. The biggest issue is that, just like in pediatric healthcare, family members are the primary agent for children, right? So you always have to have parents engage, or parents willing to let their kids, because even to set up a meeting with, for example, the patient partner for my project, 8 or 9 year old Nicholas, he doesn't have his own email, don't have his own phone number, so I have to reach out to his mother. If his mother is busy, she said, no, I cannot come drive him in person to Children's Hospital, then that's the end for that meeting. So understanding these kind of things, patients, having parents engaged as much as their child, explaining to parents why it's important to hear from them. And most importantly, before everything else, what I said is understanding that they also bring the value. Like when we were choosing logo, we thought from our adult view, we thought like, emojis would be cute for kids. So they would love it. And nobody liked them. They said like, no, what do you think of us? Like 5-year-old? We don't like emojis, like you. And we had one of this design which had this letter U. They said, because when we text each other, we don't write like Y-O-U, you just say you. So it's about us, it's about our health. So we want you. So they chose it. So this logo would attract to that kind of population. So I think if we are devising any intervention or any we are working on any projects around patient or pediatric population, it's important to engage them.
Okay. And Mallory has a question following up from that about any other vulnerable populations, and some differences with dealing with vulnerable populations, and she asked about incarcerated people. Have you any experience around patient partners?
Personally, I don't have any experience or any example for incarcerated population, but for vulnerable population, we have worked with some of the teams. So as I mentioned, we also have engaged with communities. So recently there was this outbreak, COVID outbreak at at a meat plant. So our community coordinator was able to reach out, and most of the workers in that meat plant come from a certain community, from certain ethnicity. So our community so a researcher wanted to do research around that population. So our community engagement coordinator was able to reach out to that community and find some patient partners. We also have, just last week, we did consultation with a research team where they are working with homeless population. Now it's a very tricky population to reach out for, especially for patient engagement perspective, where you might not be able to reach out to them through emails or through traditional means. So how to navigate that? And there are some strategies, and of course we won't be able to provide complete expertise on this, but we can definitely sit with you on the table and try to think of different ways to reach out to different vulnerable populations. We also have a group, one of my colleagues is working with youth mental health project. So a few years ago, a refugee teen from refugee background committed suicide because of mental health issues in Calgary, and that triggered a huge response from many non-profit organizations came together. The Canadian Commission for Mental Health got involved, and they created this project where some of the patient partners that they have, or the organization they are working with this population. So there is not one size fit for all approach. It would be different based on the different populations, but again, that's a discussion that we can have depending on the project and the population that you're trying to reach.
I think Laurel brings up a good point on this. She just said those with developmental intellectual challenges can participate with support, but they are often left out another marginalized population. And that's not to mind patient engagement, but even in recruitment for research, it is, you say, to try and get a diverse population and to reach those hardest to reach, but that is often something we struggle with in health services research.
Yes, yeah, and I totally agree that it's a very important population. Even a simple thing such as when we design some material, and this came up during one of the meeting with for one project, when we design, say, a poster for your project or something. You usually, when you want to make it diverse, you focus on the ethnicities or the skin color of the people, but you don't take into account the disability as one of the a limitation for people. That diversity you don't incorporate, or some other kind of, we just take into account visual visual features to demonstrate diversity, but the population that or the disability that you cannot see visually, you don't include that. But again, patient partnership, patient engagement offers you that flexibility to involve. So if you have, say, for example, 5 patient partner, you can intentionally be like, I want to give the perspective from this population, which usually is not involved, and actively looking for those kind of people and involving them in your project could help you on that front.
I don't have any personal experience, but I volunteer with a group that addresses the homeless issue in Edmonton, and was at a conference on homelessness 2 years ago. And there was a group doing a presentation on a research project around diabetes among the homeless and the issues that they face with just finding the proper food, attending the different shelters, the food that's provided in the shelters. But anyway, they presented their paper. It was fascinating to hear, and it was really inspiring to see the homeless patient partners who had been involved in it, and how excited they were about being part of it, and how they were able to engage and bring in information from other folks who are living on the streets.
So powerful.
Mm-hmm.
Okay, any other questions?
Yeah, and if you don't have questions, any questions now, but want to reach out later, or you go back and you just have this feeling that, I heard they were talking something about patient engagement. If it occurs to you after a month, 2 months, or later time that, I want to do patient engagement, feel free to reach out to us. We are happy to help.
There's excellent resources through the platform as well. Okay, well, thank you so much. We really appreciated your talk today from both of you. It was fantastic.
Thank you.
I think that's all the questions, so we'll leave it at that. Thank you both.
Thanks for the opportunity.
Okay, thank you everyone for joining us.
Thanks.
Take care. Bye. Are we okay to sign off?
Yeah. Bye, guys.
Okay.